Hey guys, so today I am 37 weeks pregnant, which means I'm officially full term. I can have the baby at any time now and deliver it at the birthing center and have it be perfectly fine. It's not premature. So all the major organs are developed and it's ready to go. It could happen, yeah, anytime. But I mean, usually first time moms are a little bit late. They happen after the due date typically. So preparing myself for that possibility as well and reminding myself that that's perfectly normal. I mean, due dates are really kind of a guess, like, and within a month, like, it could happen 2 to 3 weeks before or 2 to 3 weeks after. So it's really just, and every woman's different. It's based on your period cycle. And if you have a 28-day cycle, then yeah, the due date's usually pretty accurate, which I actually do. But a lot of women don't. A lot of women have longer cycles and ovulate later in their cycle. So the due date could actually be a lot further off. So, or a lot later down the line. So, but yeah, or if you have a short cycle, it could be earlier. I don't know. Anyway, had a doctor's appointment on Tuesday. It went really well. The baby is head down. It's left occiput transverse. So it's kind of like facing my left. It's not completely like anterior, but it's not posterior. It's just kind of sideways, but it's definitely vertex. It's definitely head down. So that's good. Yeah, I don't know what else. I guess I'm starting to try to get the bag ready. I was going to say hospital bag, but birthing center bag. So I need to start thinking about what I'm going to put in that. And usually at the birthing center, they only really keep you for like 4 hours. That's not an overnight ordeal. So I shouldn't need a whole lot like most women, but I just got to start thinking of that. Baby's BPM was in the 140s this week, and usually it's in the 130s pretty consistently for months now, so that was a little bit of a surprise. When she measured my belly, or uterus fundal height, whatever, I measured at exactly 36 and a half weeks, which that was 2 days ago, so yeah, that's pretty accurate because I'm 37 weeks today. In the past 3 weeks I haven't gained any weight, but it's been kind of sporadic because the appointment before that, I had gained 6 pounds in 3 weeks. So it's up and down. But total weight gain is 28 and a half. So I guess I'm pretty average as long as I don't really pack it on these last 3 weeks. I guess I'll be within the recommended weight gain. But we'll see. I've still been walking, but it's hard to walk very far without having a very ticklish urge to pee. And then I try to go to the bathroom, barely anything comes out. So I go back out walking and I get that same little extremely ticklish feeling that I really, really have to pee again. So I don't know. I guess that's what happens. I've been sleeping okay. I've really only been waking up once in the night to go to the bathroom, so that's good. I have one of those body pillows that's like a U shape that wraps all the way around me. It's like I'm sleeping in a cloud. Blood pressure is good. It was 118/52. I don't know. I'm just really happy that the baby's head down. I was really thinking that it had a transverse lie or oblique lie because every time I would feel the hiccups, they would be to my left. They would be down lower, but they would be to my left. So yeah, I was kind of thinking that it wasn't completely like in the pelvis. So, but now I know that it is. I've been going to the chiropractor just to make sure everything's all lined up and straightened. Pelvis is in good form because I've read lots of studies that say women that go to a chiropractor a couple weeks before giving birth have a much easier labor. So I've been doing that. Yeah, just nesting and resting. I have like pregnancy-induced OCD these days, just rearranging things. And I don't even know why I'm bothering to do that because once the baby comes, I'm sure I'm going to set it up the way I want and rearrange things anyway once I kind of know what to expect and have the baby. So all the stuff that I'm doing now and keeping busy with is just kind of tedious stuff. So, I started making the wedding album. We got married last August and we don't have a hard copy of our wedding pictures, like a hard copy wedding album or like framed pictures around the house. So I've been doing that, picking out which ones I want to use because I figure if I don't do it now, I'll never do it. So that's been good. Spending time with friends indulging a little bit, taking naps in the afternoon because I figure I won't be getting much sleep once the baby comes. So really spending a lot of time focusing on hypnosis and meditation and like practicing the affirmations for birth, and really try to read a lot of books on visualizing a positive birth and things like that. I have been reading and listening to a lot of podcasts lately. Some of my favorites are the Birth, Baby, and Life podcast with Kristen Burgess, Preggy Pals, Pregtastic, Birth Without Fear with Alexia Leachman. She's British. She has a cool accent. The Bump Club, Diaper Dirt with Dana Ryan. Easier, Healthier Birth podcast with Sarah Blight. Well Adjusted Mama, One Bad Mother, P in the Podcast. Mighty Mommy, Zen Parenting Radio. Yeah, there's lots of good ones. And I have a whole birth playlist that I've been looking at. Just a lot of YouTube videos and things like that. A lot of documentaries. Books. I read The Womanly Art of Breastfeeding. It's like a huge Bible, like breastfeeding Bible, basically. It's very thick, but very informative. Sarah Buckley, Gentle Birth, Gentle Mothering, Childbirth Without Fear. Beyond the Sling by Miam Balick. The Vaccine Book by Robert Sears. Ina Mae Gaskin, Spiritual Midwifery, Guide to Childbirth. All those are really good. But yeah, just a lot of reading and kind of getting in that state of mind. So no cravings, just eating a lot. No back pain, knock on wood. But I've been really lucky. I'm getting bigger. I'll show you my bump now, and that's pretty much all I have left to say for this podcast. So if you have any questions, definitely leave them below. But here's my bump. Bye.